Thank you for the course directors for having me, and thank you all for joining us. So today I'm going to be talking about radiofrequency microneedling. None of the companies I do work with make a device, so it's not relevant. So just a quick show of hands, how many of you in the room actually do RF microneedling in your practice? Okay, so I'd say about half. So, this technology, I feel like in the last, 5 to 7 years has really taken off. And I think it's because the utility, we can use it for so many different things. In the literature, you'll find, improvement in scars, acne, actual acne and acne scarring, hyperhidrosis, rosacea, photoaging, striae, skin tightening, melasma. So a whole host of things you can do with one device and a lot of different skin types too. About 2 years ago, we published this review going over each of the indications and on the literature behind it. So if you have additional questions, I'm going to be very brief and cover, the high points, but this was a review article Jeff Dover and I worked on going into the nitty-gritty of each device. So let's start with the basics. It's a minimally invasive procedure. It has a lot of utility because you can adjust your depth and energy. We get just little needle perforations in the epidermis. You can deliver RF energy directly to the dermis, leading to neocollagenesis. You can also use it for assisted drug delivery, so cutaneous absorption of topical products. All of these essentially promote the secretion of growth factors. You get new keratinocytes, fibroblasts that lead to skin remodeling. So it's important to know there's many devices on the market. There's over 20 that are FDA approved. We can, in my mind, I really divide them by their pulse duration. So we have the short pulse duration and the long pulse duration. So the short pulse duration are going to be your 200 to 800 milliseconds. These are the devices you do with topical numbing. They need multiple treatments. Maybe you do a series of 3. These are going to be smaller volume tissue treatment. The needles do vary in quality, size, and array. The motor mechanisms vary. It's really hard to compare across platforms. I use the analogy, it's like apples and oranges because no two devices are the same. And then some of them measure impedance and energy delivery. This is in contrast to the long pulse duration. So since this is a non-CME, I can mention devices. So the Profound, which is one of the first that came out in 2014, this is a single treatment. It's about a week of downtime. These patients are pretty uncomfortable, so you need to do either local or tumescent anesthesia, usually nerve blocks. And there's a large volume of tissue it's exposed. You're exposing the tissue to much higher heat, and you get more neocollagenesis, more elastogenesis, and some of the devices actually have a thermistor sensor so you can measure real-time temp. We know you need to get to at least 65 degrees Celsius to get that neocollagenesis response. The devices also vary in the types of needles. So some of the tips, will have insulated or non-insulated, or you could actually purchase different tips depending on your patient type and indication. So you can see the non-insulated tips, you're delivering heat across the entire needle, versus your insulated tips, you're only delivering heat on the tip of the needle. This is important when it comes to your darker skin types. So in your skin types, 4, 5, and 6, you want to be very cautious or avoid a non-insulated needle because you can activate some of that epidermal melanin and lead to PIH. So just know what device you're using. This was a list from about a year ago. So the only devices not on here are the Silfirm and the new Candela Cutera Matrix. But you can see that there's a lot of variability in terms of the length of the needle, the number of needles, are they insulated or non-insulated, the motor. So just know that no two devices are the same. There's a lot of variability, but know what you're using. Some of them have the ability to have different tips. You can have a non-insulated tip or an insulated tip. So they all vary in cost, so just know that they aren't all the same, and know your patient type, your indications, and then what you're going to be using. So a little bit more about the science. When your needles penetrate the skin, the epidermis benefits from needling, and then the RF thermal zones go into the dermis without injury. We are able to get temps anywhere from 60 to 75 degrees Celsius, and that's what causes this, our dermal collagen fibrils to shorten and then stimulate new collagen. And then the energy is able to be delivered much deeper than contact RF, so you don't need cooling on the surface. And as I mentioned, it is safe in all skin types. So looking at this schematic with our other devices, you can see on the far right, you have ablative CO2, so you can see that microthermal zone in the epidermis and dermis. Your non-ablative devices, which we heard from Dr. Friedman, you're sparing your epidermis, delivering heat into the dermis. And then, looking next to that, your non-insulated needle, so you can see you're getting that zone of neocollagenesis around the entire needle. And then your insulated needles generally can go a little deeper because you're just heating around the tip. They also have the ability to deliver a different depth, so many times with these millisecond devices, they'll talk about doing multiple passes, usually 3 passes, to get neocollagenesis collagenesis at different depths. And we do know from the histologic studies, we get new collagen, elastin, and hyaluronic acid. So it's important to understand that, these are not lasers, and how is laser heating different than RF heating. So laser light is selectively absorbed based on our chromophore. It's absorbed in the tissue, versus RF emits energy and it's delivered through the tissue. Some of the devices do measure impedance, but tissue with a higher impedance is going to have a higher resistance of flow, and then the higher resistance increases temperature in tissue versus the surrounding tissue. So just know that there can be some variability based on skin type and other factors. So once again, looking at the different modalities, so we have our fractional RF microneedling, once again with 3 passes. Some of the newer devices I was hearing about with 1 single pulse, you can deliver energy at 3 different passes, which saves time. The traditional devices, you have to adjust your depth and energy to get the neocollagenesis at the different depths. And generally, these are able to go deeper than your lasers or other contact RF devices. So looking at some histology, this is with one of the Lutronic devices, the needle injuries with various millijoule and needle sizes. You can really change your zones of neocollagenesis. So you can see with 20 millijoules, 80, 40, and 100. So you might want to be more aggressive if someone has deep acne scarring, or if you're trying to get some tightening versus targeting more superficial things. So the procedure itself is fairly straightforward. This is generally for your millisecond devices, a topical anesthetic. I use 23/7 in my practice. We do 30 to 60 minutes. If you are using one of the seconds devices, like the Profound, you would want to consider doing local anesthesia, nerve blocks, 2-method anesthesia. Some of my patients are really sensitive, so even with the millisecond device, they have a lot of pain. So I'll use a mesoram device that's just a multi-injector, and you can numb them pretty quickly. You do multiple passes, usually starting with the deepest pass, and then go more superficial, lower energy. With this, there's no specific endpoint, so you're not gonna. You might see some erythema, you might see some edema. With some of the devices, you can get pinpoint bleeding, but it's a little bit hard to tell. There are some warning signs. You want to make sure you're not getting like little areas of denatured collagen if you don't have good contact. So it's firm pressure, making sure you don't lift the device before it's done firing, and then after the treatment, you can utilize some of the little channels. You can apply PRP, you can apply hyaluronic acid serums. Just make sure you know what you're applying. Not all products are meant for dermal delivery. So, sometimes you can just leave it and not apply anything. And then we always give our patients post-care instructions. I instruct them that they can wear makeup and sunscreen the next day, obviously avoid the sun, and avoid any medicated topicals for 1 week. So the benefits of doing this procedure, you bypass and protect the epidermis. You can treat all skin types. These coagulation zones give you new collagen, new elastin, new hyaluronic acid. You can really customize the treatment to deliver energy in the quantity and depth that's desired. You can also treat other areas. We many times do the neck. I've done abdomen, knees, other areas on the body. And for the most part, you can adjust settings, and with topical numbing and a chiller and ice, you can manage pain, side effects, and downtime. Other considerations, the needle depth, there was several studies published that, when you set a device to 3 or 4 millimeters, are you actually getting that deep? We don't know. A lot of it depends on the motor. There's impedance. You're obviously encountering other structures. It depends on the operator, how hard you're pressing and how much pressure. So, we don't always get the depth that we set it to. In terms of energy, is the desired energy being delivered to the skin? That's, once again, it varies by device and the operator. And then the biggest factor is the needle design. So, how sharp are the needles? Are they 32, 34 gauge? Are they insulated or not? The design, the size, the number, so a lot of different variables, especially the insulated, non-insulated. The motor is what affects how quickly you can penetrate in the skin, and then impedance is the feedback from the tissue of the desired energy. One of the devices, the Lutronic Genius, actually measures impedance, so these are all different factors to consider. Other considerations are kind of their post-care. So, pain, erythema, swelling, they can have purpura. Those are temporary, resolve within 7 days. I do kind of warn them about that. I fortunately have not really had much PIH in my practice, but, if they do get it, you can tell them it resolves with time. You can use skin brighteners after, and even, other modalities if it doesn't resolve with photoprotection. Keep in mind those non-insulated needles will increase the risk of PIH because you're heating the epidermis, so we avoid those in skin of color, and then also avoid superficial depths. That 1.5 millimeter, be very cautious in your darker skin patients, and a lot of this is operator dependent. So I'm just going to wrap things up with some patients that I've treated. As many of us do, these are combination treatments, so it's not just one. I did use biostimulators in this patient also, but she didn't want surgery. She had a lot of medical comorbidity. She was actually a post-transplant patient. She was like, look, I know I probably need a facelift. I don't want to go that route. So we did 3 treatments with pretty aggressive RF microneedling. I did 2 rounds of biostimulators, and it was a very acceptable result. Helped some of the laxity and also in her neck. A middle-aged woman here. once again, she was just noticing some signs of aging. This was like right during COVID. She had a lot of that Zoom boom, saw herself, and was very, dissatisfied. So we did 2 rounds of RF microneedling, and then we did 1 round of biostimulators with a nice result to like the lower face and neck. So in summary, safe in all skin types. You can really get nice improvement in texture, fine lines, and laxity. You get new collagen, elastic fibers, and hyaluronic acid. Minimal downtime. Most of my patients are wearing makeup the next day. They may have a little bit of swelling, but it's like just a weekend procedure. You can get these direct thermal coagulation that you can control the depth, power, and exposure time. The biggest thing is there's a lot of devices on the market, so know what you're using, know your patient type, and know the different variables. So I know we're going to take questions at the end, but this is my email if there's anything else, and then we will just, I'll be on the panel at the end to answer questions. So thank you for your attention.